Question 1. A licensed practical/vocational nurse, LPN/LVN, is caring for a client with type 2 diabetes mellitus who reports feeling shaky, lightheaded, and extremely hungry. The client's blood glucose is 68 milligrams per deciliter. What is the most appropriate initial action for the LPN/LVN to take? A. Administer 15 grams of a fast-acting carbohydrate. B. Prepare to administer intravenous dextrose. C. Document the client's symptoms and blood glucose level. D. Instruct the client to eat a balanced meal immediately. Answer: A. Administer 15 grams of a fast-acting carbohydrate. This question tests your immediate action in a hypoglycemia, low blood sugar, emergency, which is a critical concept in diabetes care. The keywords shaky, lightheaded, hungry, and blood glucose is 68 milligrams per deciliter clearly indicate hypoglycemia. The most appropriate initial action for an LPN/LVN is to administer 15 grams of a fast-acting carbohydrate, such as fruit juice or glucose tablets, to rapidly raise the client's blood sugar. This prompt intervention is essential to prevent the client's condition from worsening and is within the LPN's scope of practice, unlike administering 4-dextrose, which typically requires an RN or physician order in some settings. Always prioritize immediate safety when a client exhibits acute symptoms. Question 2. The LPN/LVN is preparing to administer medication to a client via a nasogastric (NG) tube. Before administering the medication, which action is most important for the LPN/LVN to perform? A. Check the client's gag reflex. B. Aspirate gastric contents to check residual volume. C. Clamp the nasogastric tube for 30 minutes. D. Ensure the medication is crushed and mixed with a large amount of water. Answer: B. Aspirate gastric contents to check residual volume. This question focuses on safe medication administration via an NG tube, a common nursing procedure. The most important initial action before administering medications or feedings through an NG tube is to aspirate gastric contents to check for residual volume, which indicates how much liquid remains in the stomach. A high residual volume might suggest delayed gastric emptying, increasing the risk of aspiration if more fluids are added. This step helps ensure the client's safety and proper absorption of the medication. Always prioritize checking tube placement and stomach emptying before giving anything through an NG tube. Question 3. An LPN/LVN is providing care for a client who is receiving intravenous 4 fluids. The client reports pain and swelling at the 4 insertion site, and the LPN/LVN observes redness and coolness to the touch. Which complication does the LPN/LVN suspect? A. Phlebitis. B. Infiltration. C. Infection. D. Air embolism. Answer: B. Infiltration. This question tests your ability to identify common intravenous therapy complications based on client symptoms and physical assessment findings. The key symptoms, pain and swelling at the 4 insertion site, combined with redness and coolness to the touch, are classic signs of infiltration, which occurs when non-vesicant 4 fluid leaks out of the vein and into the surrounding subcutaneous tissue. Phlebitis typically presents with warmth and a red streak along the vein, while infection would show purulent drainage and fever. Recognizing these distinct signs is crucial for prompt intervention and preventing further tissue damage. Question 4. An LPN/LVN is reinforcing teaching with a client who is being discharged after a myocardial infarction, MI. Which statement by the client indicates a need for further teaching? A. I will take my nitroglycerin at the first sign of chest pain. B. I should avoid strenuous activities like heavy lifting. C. I can eat anything I want as long as I take my cholesterol medication. D. I need to call my doctor if I experience shortness of breath or increased swelling in my ankles. Answer: C. I can eat anything I want as long as I take my cholesterol medication. This question assesses your understanding of post-myocardial infarction client education and the importance of lifestyle modifications. The statement, "I can eat anything I want as long as I take my cholesterol medication," indicates a significant knowledge deficit because diet plays a crucial role in managing heart disease and preventing future cardiac events. Even with medication, clients recovering from an MI need to adhere to a heart-healthy diet, typically low in saturated fats, cholesterol, and sodium. Effective teaching ensures the client understands that medication is part of a comprehensive management plan, not a sole solution. Always look for statements that show a lack of understanding about the full scope of their self-care. Question 5. The LPN/LVN is assisting with the care of an older adult client who has developed new-onset confusion and restlessness. Which action should the LPN/LVN prioritize? A. Administer a prescribed sedative to calm the client. B. Orient the client to time, place, and person frequently. C. Assess the client for potential causes such as infection or medication side effects. D. Notify the client's family about the change in mental status. Answer: C. Assess the client for potential causes such as infection or medication side effects. This question requires critical thinking and prioritization in a scenario involving a change in a client's mental status, a common NGN-style emphasis. New-onset confusion and restlessness in an older adult are often signs of an underlying medical issue, such as a urinary tract infection, UTI, pneumonia, dehydration, or an adverse reaction to medication. Administering a sedative without identifying the cause could mask a treatable condition and worsen the client's outcome. Therefore, the priority is to assess for reversible causes, gather data, and report findings to the registered nurse or healthcare provider for further evaluation and intervention. Question 6. An LPN/LVN is reinforcing teaching with a client about preventing urinary tract infections, UTIs. Which statement by the client indicates understanding of the teaching? A. I should drink less water so I don't have to urinate as often. B. I should always wipe from back to front after using the toilet. C. I need to empty my bladder regularly, even if I don't feel a strong urge. D. Cranberry juice is not effective in preventing UTIs. Answer: C. I need to empty my bladder regularly, even if I don't feel a strong urge. This question tests knowledge of client education for preventing common health issues, specifically urinary tract infections. The correct understanding is that emptying the bladder regularly helps flush out bacteria and prevents their accumulation, thereby reducing the risk of infection. Wiping from back to front can introduce bacteria into the urethra, and drinking less water concentrates urine, making it a better breeding ground for bacteria. Encouraging regular bladder emptying is a key strategy in UTI prevention. Question 7. The LPN/LVN is caring for a client with a new colostomy. The client expresses anxiety about learning to care for the stoma. What is the most appropriate nursing action for the LPN/LVN? A. Tell the client that many people adapt well to a colostomy. B. Demonstrate the colostomy care procedure and allow the client to practice. C. Provide the client with a detailed written pamphlet about colostomy care. D. Reassure the client that the nurse will handle all colostomy care during the hospital stay. Answer: B. Demonstrate the colostomy care procedure and allow the client to practice. This question assesses the LPN's role in client education and promoting self-care, particularly for a new ostomy. The key is the client's expressed anxiety about learning to care for the stoma. The most effective way to alleviate this anxiety and promote self-efficacy is through hands-on teaching, allowing the client to observe the procedure and then practice it with supervision. This practical approach, known as show, then do, helps build confidence and ensures the client gains the necessary skills for discharge. Simply providing information or reassurance without active participation is less effective for psychomotor skills. Question 8. An LPN/LVN is assisting a client with ambulation who has right-sided weakness. What is the correct technique for the LPN/LVN to use? A. Stand on the client's strong side and slightly behind them. B. Stand on the client's weak side and slightly behind them. C. Walk several steps ahead of the client to clear the path. D. Have the client use a walker, and the LPN/LVN stands at a distance. Answer: B. Stand on the client's weak side and slightly behind them. This question focuses on safe client mobility and fall prevention, a critical aspect of LPN/LVN care. When assisting a client with unilateral weakness, the LPN/LVN should stand on the client's weak side and slightly behind them, providing support with a gait belt if available. This position allows the nurse to immediately intervene if the client begins to lose balance on their weaker side, preventing a fall. Standing on the strong side or too far away would not provide adequate protection. Question 9. An LPN/LVN is reinforcing discharge teaching to a client with chronic obstructive pulmonary disease, COPD, about managing their condition at home. Which statement by the client indicates effective teaching? A. I will use my oxygen only when I feel very short of breath. B. I will avoid getting the flu shot every year because it makes me feel sick. C. I need to notify my doctor if my sputum changes color or increases in amount. D. I should limit my fluid intake to prevent fluid overload. Answer: C. I need to notify my doctor if my sputum changes color or increases in amount. This question tests understanding of essential self-management strategies for chronic respiratory conditions like COPD. A change in sputum color or amount can indicate a worsening infection or exacerbation, which requires prompt medical attention to prevent severe complications. Limiting fluids can make secretions thicker, hindering clearance, and oxygen should be used as prescribed, not just PRN if the client has chronic hypoxemia. Annual flu shots are crucial for clients with COPD to prevent respiratory infections. Recognizing signs of worsening condition is a key aspect of client education for chronic illnesses. Question 10. The LPN/LVN observes an unlicensed assistive personnel, UAP, administering a cleansing enema to a client. Which action by the UAP requires immediate intervention by the LPN/LVN? A. The UAP positions the client on their left side with the right leg flexed. B. The UAP holds the enema bag no more than 12 to 18 inches above the client's anus. C. The UAP inserts the enema tubing 5 inches into the rectum. D. The UAP rapidly infuses the enema solution when the client reports cramping. Answer: D. The UAP rapidly infuses the enema solution when the client reports cramping. This question assesses the LPN/LVN's ability to supervise and intervene when observing a UAP's performance, a key aspect of coordinated care and delegation. Rapid infusion of enema solution, especially when the client reports cramping, can cause excessive discomfort, abdominal distension, and potentially stimulate a vagal response or bowel perforation. The appropriate action is to slow the infusion or temporarily clamp the tubing until the cramping subsides. The other options describe correct or acceptable enema administration techniques. This scenario highlights the LPN/LVN's responsibility for client safety even when delegating tasks. Question 11. An LPN/LVN is performing wound care for a client with a pressure injury. After removing the soiled dressing, which action should the LPN/LVN prioritize? A. Apply a new sterile dressing immediately. B. Document the appearance of the wound. C. Assess the wound bed and surrounding skin for signs of healing or deterioration. D. Reposition the client to relieve pressure on the wound. Answer: C. Assess the wound bed and surrounding skin for signs of healing or deterioration. This question emphasizes the assessment phase of the nursing process, particularly in wound care. After removing a soil dressing, the priority before applying a new one or documenting is to thoroughly assess the wound bed, margins, and surrounding skin for critical details like size, depth, drainage, tissue type, and signs of infection or healing progress. This assessment guides subsequent interventions and provides essential data for documentation and communication to the healthcare team. Applying a new dressing without proper assessment would be premature. Question 12. The LPN/LVN is caring for a client who is NPO, nothing by mouth, for an upcoming surgical procedure. The client repeatedly asks for water, stating they are very thirsty. What is the most appropriate response by the LPN/LVN? A. I understand you're thirsty, but you cannot have anything to drink before surgery. B. Let me get you a small cup of ice chips, as that's allowed. C. I will call the doctor to see if they can order you some water. D. I can offer you a moistened swab for your mouth. Answer: D. I can offer you a moistened swab for your mouth. This question tests therapeutic communication and understanding of NPO status protocols. When a client is NPO, providing anything by mouth, even ice chips, is typically contraindicated due to aspiration risk during anesthesia. The most appropriate and safe action is to offer comfort measures like oral hygiene or a moistened swab to alleviate dryness without violating NPO orders. This intervention shows empathy while adhering to safety protocols. Question 13. An LPN/LVN is assisting with the admission of a client diagnosed with Clostridium difficile, C. diff, infection. Which personal protective equipment, PPE, should the LPN/LVN don before entering the client's room? A. Standard isolation gown and gloves. B. N95 respirator, gown, and gloves. C. Surgical mask, gown, and gloves. D. Goggles, gown, and gloves. Answer: A. Standard isolation gown and gloves. This question assesses knowledge of infection control principles, specifically contact precautions. Clostridium difficile, C. diff, is primarily transmitted through direct contact with contaminated surfaces or individuals. Therefore, the essential personal protective equipment, PPE, required for contact precautions includes a standard isolation gown and gloves to prevent transmission. An N95 respirator is for airborne precautions, e.g., tuberculosis, and a surgical mask is for droplet precautions, e.g., influenza, neither of which is the primary mode of C. diff transmission. Question 14. The LPN/LVN is collecting data on a client admitted with fluid volume overload. Which assessment finding would the LPN/LVN expect to observe? A. Decreased blood pressure and dry mucous membranes. B. Bounding pulse and crackles in the lungs. C. Increased urine output and flat neck veins. D. Poor skin turgor and thirst. Answer: B. Bounding pulse and crackles in the lungs. This question assesses understanding of the clinical manifestations of fluid volume overload. A bounding pulse indicates increased circulatory volume, and crackles, rowels, in the lungs are a classic sign of fluid accumulation in the alveoli, often due to pulmonary edema. Decreased blood pressure, dry mucous membranes, increased urine output, if kidneys compensate, flat neck veins, poor skin turgor, and thirst are typically signs of fluid volume deficit, dehydration. Recognizing these characteristic signs helps the LPN/LVN accurately report findings and contribute to the client's plan of care. Question 15. An LPN/LVN is preparing to administer an oral medication to an adult client. After verifying the medication order and checking the client's identity, what is the next essential step in the medication administration process? A. Document the medication administration. B. Perform hand hygiene and don gloves. C. Administer the medication to the client. D. Explain the medication's purpose to the client. Answer: B. Perform hand hygiene and don gloves. This question focuses on the essential steps of safe medication administration, emphasizing infection control. After verifying the order and client, the next critical step is to perform hand hygiene and don gloves, if indicated, e.g., for oral meds to prevent contamination of the medication itself or if contact with body fluids is anticipated. This prevents the transmission of microorganisms and ensures a clean process before handling and administering the medication to the client. Administering the medication comes after this step, and documentation occurs after administration. Question 16. The LPN/LVN is reinforcing teaching with the spouse of a client with Alzheimer's disease regarding home safety. Which statement by the spouse indicates understanding of the teaching? A. I should keep the house dimly lit to help my spouse relax. B. I will place locks on exterior doors, high or out of reach. C. I can leave medications on the counter for easy access. D. It's best to rearrange furniture frequently to provide variety. Answer: B. I will place locks on exterior doors, high or out of reach. This question assesses an LPN/LVN's ability to provide effective safety education for clients with cognitive impairments, like Alzheimer's disease. Placing locks on exterior doors high or out of reach is a crucial safety measure to prevent wandering and ensure the client's safety, as individuals with Alzheimer's often experience disorientation. Dim lighting can increase confusion, medications should be secured to prevent accidental overdose, and frequent rearrangement of furniture can disorient a client with cognitive deficits. Safety measures adapted to cognitive decline are paramount. Question 17. The LPN/LVN is caring for a client post-appendectomy who is complaining of 8/10 incisional pain. The client's last dose of pain medication was 6 hours ago. What is the most appropriate action for the LPN/LVN to take? A. Reassure the client that pain is normal after surgery. B. Document the pain score in the client's chart. C. Administer the prescribed PRN pain medication. D. Encourage the client to try deep breathing exercises. Answer: C. Administer the prescribed PRN pain medication. This question focuses on pain management and the LPN/LVN's role in addressing client discomfort. When a client reports significant pain, 8/10, and it has been 6 hours since their last pain medication dose, the most appropriate and immediate action is to administer the prescribed PRN, as needed, pain medication. While documentation, reassurance, and complementary therapies are important, the priority is to relieve acute pain, as prescribed, when indicated by the client's symptoms and medication schedule. Always act promptly to manage client pain. Question 18. An LPN/LVN is caring for a client with a new tracheostomy. Which observation requires immediate intervention by the LPN/LVN? A. Small amount of clear, thin secretions. B. Respiratory rate of 18 breaths/minute. C. Client's skin around the stoma is red and excoriated. D. Oxygen saturation of 96% on supplemental oxygen. Answer: C. Client's skin around the stoma is red and excoriated. This question tests the LPN/LVN's ability to identify priority issues in tracheostomy care, focusing on potential complications. Red and excoriated, irritated or abraded, skin around the stoma indicates skin breakdown, which can lead to infection, discomfort, and compromise the integrity of the stoma site. This requires immediate intervention to clean, protect, and manage the skin, potentially adjusting dressing changes or stoma care techniques. Small, clear secretions, a normal respiratory rate, and good oxygen saturation are expected or stable findings. Question 19. The LPN/LVN is performing a focused assessment on a client with a history of heart failure. Which finding would be most concerning and require immediate notification of the registered nurse, RN? A. Client reports a weight gain of 3 pounds over 2 days. B. Client reports occasional shortness of breath with exertion. C. Client's capillary refill is less than 2 seconds. D. Client states they forgot to take their diuretic this morning. Answer: A. Client reports a weight gain of 3 pounds over 2 days. This question requires prioritization and understanding of worsening heart failure signs. A rapid weight gain, such as 3 pounds in 2 days, is a significant indicator of fluid retention and worsening heart failure. This acute change could signal impending pulmonary edema and requires immediate intervention to prevent respiratory distress. Occasional shortness of breath with exertion is a common, chronic symptom of heart failure, and while capillary refill less than 2 seconds is normal, forgetting a diuretic also contributes to fluid retention, but the actual weight gain is the direct and most concerning evidence of fluid accumulation needing prompt action. Question 20. An LPN/LVN is reinforcing teaching for a client who is prescribed Warfarin. Which food should the LPN/LVN advise the client to consume consistently, avoiding significant fluctuations in intake? A. Red meat. B. Citrus fruits. C. Green leafy vegetables. D. Dairy products. Answer: C. Green leafy vegetables. This question tests the LPN/LVN's knowledge of essential client education related to anticoagulant therapy, specifically Warfarin. Warfarin works by interfering with vitamin K-dependent clotting factors. Green leafy vegetables, such as spinach, kale, and broccoli, are high in vitamin K. Significant fluctuations in the intake of vitamin K-rich foods can alter the effectiveness of Warfarin, either increasing the risk of clotting, too much vitamin K, or bleeding, too little vitamin K. Clients on Warfarin should be advised to maintain a consistent intake of these foods, not to avoid them entirely, to help maintain a stable INR. Question 21. The LPN/LVN is caring for a client who suddenly becomes confused and disoriented. What is the most appropriate initial action for the LPN/LVN? A. Apply wrist restraints to ensure the client's safety. B. Increase the client's environmental stimuli to reorient them. C. Assess the client's vital signs and blood glucose level. D. Administer a PRN sedative to calm the client. Answer: C. Assess the client's vital signs and blood glucose level. This question is an NGN-style item focusing on prioritizing assessment when a client's condition changes. New-onset confusion and disorientation can be indicative of various acute medical issues, such as hypoglycemia, hypoxia, infection, or a stroke. The most appropriate initial action is to perform a rapid assessment of vital signs and blood glucose to rule out immediate life-threatening causes that are reversible. Applying restraints or sedatives without identifying the underlying cause can mask the problem and delay appropriate treatment. Question 22. An LPN/LVN is assisting with the care of a client who has a new prescription for oxygen therapy via nasal cannula. The LPN/LVN explains the purpose of the humidification bottle. Which explanation is most accurate? A. It adds moisture to the oxygen to prevent dryness and irritation of the nasal passages. B. It warms the oxygen before it reaches your lungs. C. It filters out bacteria from the oxygen before you breathe it in. D. It ensures that the correct amount of oxygen is delivered. Answer: A. It adds moisture to the oxygen to prevent dryness and irritation of the nasal passages. This question assesses the LPN/LVN's understanding of basic respiratory therapy equipment and client education. Oxygen is a dry gas, and prolonged administration, especially at higher flow rates, can dry out and irritate the mucous membranes of the nose and throat, leading to discomfort and potential bleeding. The humidification bottle adds water vapor to the oxygen, preventing this dryness and improving client comfort. It does not primarily warm the oxygen, filter bacteria, or regulate the flow rate. Those are functions of other components of the oxygen delivery system. Question 23. An LPN/LVN is documenting care for a client who fell out of bed. Which statement is an example of objective documentation? A. Client states, "I feel so clumsy today." B. Client fell out of bed, appears to be in pain. C. Client found on floor beside bed, right hip externally rotated. D. Client seems restless and anxious after the fall. Answer: C. Client found on floor beside bed, right hip externally rotated. This question tests the LPN/LVN's understanding of objective versus subjective documentation, a crucial skill in nursing. Objective documentation includes observable, measurable facts, free from personal opinions or interpretations. Client found on floor beside bed, right hip externally rotated is an objective observation that can be seen and verified by others. Statements like appears to be in pain, seems restless, or what the client states are subjective, requiring interpretation, or are direct quotes, respectively. Question 24. The LPN/LVN is reinforcing teaching to a client about proper hand hygiene. Which statement by the client indicates a need for further teaching? A. I should wash my hands with soap and water for at least 20 seconds. B. I can use alcohol-based hand sanitizer if my hands are visibly soiled. C. I should rub my hands together vigorously, covering all surfaces. D. I should wash my hands before eating and after using the restroom. Answer: B. I can use alcohol-based hand sanitizer if my hands are visibly soiled. This question tests knowledge of infection control and the appropriate use of hand hygiene methods. Alcohol-based hand sanitizers are effective for routine hand antisepsis when hands are not visibly soiled. However, if hands are visibly soiled with dirt, blood, or body fluids, or after caring for clients with C. difficile, soap and water must be used to physically remove contaminants. Therefore, the client's statement about using hand sanitizer on visibly soiled hands indicates a need for further teaching. Question 25. An LPN/LVN is assisting with discharge planning for an older adult client who lives alone and has impaired mobility. What is the most important consideration for the LPN/LVN to discuss with the interdisciplinary team? A. The client's preferred meal choices at home. B. The need for home health aid services for activities of daily living, ADLs. C. The client's favorite television programs. D. The best time for the client to receive visitors. Answer: B. The need for home health aid services for activities of daily living, ADLs. This question focuses on coordinated care and discharge planning, particularly for a vulnerable client. For an older adult living alone with impaired mobility, the most important consideration for safe discharge and continued well-being is ensuring support for activities of daily living, ADLs, like bathing, dressing, and ambulating. This directly impacts their ability to function safely at home and prevents readmission due to lack of support. While other factors might be discussed, ensuring basic care needs are met is paramount for discharge success.